Hi, I'm Dr. Alvarez with Endobariatric.com, and today I am here with a very special guest. This is Laura, and Laura is a former patient.
Correct.
And you had surgery how long ago, Laura?
About 6 weeks ago on December the 27th.
6 weeks ago, only 6 weeks ago, and this is a different testimonial.
Correct.
Rather than being 12 months out or 18 months out. And well, you might want to tell the audience why you are back here at Endo Hospital.
Because I had a fantastic experience, and I'm here with two friends who had surgery today.
Today.
Yes.
Very good. So I thought it was a great idea to do like a short video that we're here, short testimonial of, because a lot of people ask themselves, like they're looking into the sleeve is, what can I expect the first few weeks, the first month out of surgery? What can you tell them?
Well, every email that they get from you,
Yes.
they need to read about 3 times, make sure they're following it. And that's what I did. I read those emails, I followed the diets that you told me to do, and I've lost almost 36 pounds.
36 pounds
Yes.
in 6 weeks.
Correct.
Awesome. Yes, following your doctor's guidelines is crucial for a smooth recovery.
Yes, I haven't, nothing has really made me sick as I've gone along and tried different things. You know, I haven't felt bad about things. So, I mean, follow the doctor's advice. It works.
Awesome. Now, you're back here with two friends. Let me go back just a little bit.
Okay.
Why Mexico?
My insurance that I have with work does not cover weight loss surgery.
All right.
I live a little bit north of Houston, so I looked around all over the country, really. And then a friend of mine, her sister-in-law came here about 2 years ago.
Okay.
So I got to doing my research and...
Off to Mexico.
Yeah, off to Mexico.
You drove down
Correct.
all the way to Eagle Pass, or you got picked up by our van?
Oh, no, like my car's out in the parking lot.
Perfect. All the way down here to the
I've
hospital.
been to Piedras before, so...
Very good.
Yeah.
And how is the crossing of the border into Mexico?
Oh, super easy. I think it took us about, 3 or 4 minutes. Yes, or day before yesterday, and that was just because there was traffic. And then, going back, might take us 15, 20 minutes.
Correct. That's our average,
Yeah.
more or less. Very good. And what changes have you seen in just 6 weeks out of surgery?
So, I'm down 2 pant sizes. I've had to go shopping for new clothes to wear to work, which has been a lot of fun. And just in how I look at stuff, when I go to the grocery store and I pick up a can or a package or whatever, I look at the different, if it doesn't have a lot of protein, I usually just set it back down and it's not going to go in the grocery cart.
So you're a little bit more aware now.
Yes, very much so.
Makes you more aware of what you're putting into your system.
Correct, yes.
Yes. How about the physical? I mean, not the looks. I mean, I know you've dropped a significant amount of weight in a short period of time, but like parameters of quality of life.
I sleep better.
Good.
I don't necessarily want to. I'm not tired as much, anymore. The first week I was, but I think I had surgery.
Recovered.
But now I can get up. This morning I got up and did several laps around the parking lot here while I was waiting for you to talk to me. Tell me how my friends were.
Now you're more active now.
Yes.
Very good. And I tell patients sometimes it's just the little things in life, like bending over, like tying your shoelaces.
Yes.
Flight of stairs, and
Right.
you're not gasping for air. Stuff like that makes a world of difference.
Yes, it does.
And I know you have a lot more down the road to experience, and you're going to be losing more and more weight. And I know you're thrilled right now. It'll go beyond that. I mean, it'll be mind blowing.
Awesome.
And but it's important for people to understand. Well, how about your recovery right immediately after surgery? How was surgery day after, 2 days after?
Well, I was fine. I got up that evening, and walked a lot in the hospital. The next morning, I got out and walked in the parking lot here. I enjoyed the spa that afternoon. And in fact, the next day, my friend that came with me, we actually stopped in San Antonio that night and walked on the Riverwalk for a while and looked at the Christmas lights. And I think that really helped me just, walking.
Let me ask you this. This is a big question on a lot of patients coming down from Canada and the United States to us. Have you ever felt alone after surgery?
Oh, no.
Like,
not at all.
The doctor did your surgery and do and forget.
No. I think whenever I was a patient here, I think I saw you 6 times in those 3 days. So
I personally discharged my patients.
Yes, you walked us out.
Correct.
You sat and talked with us the night before.
Correct.
You came and saw us before we had surgery. You
Correct.
2 or 3 times, and
yes,
you walked us out. So hugged us and we took our.
And all those emails that you mentioned that
yes.
I send out to you, I tell patients that at any given point you can hit reply to those emails. I get a copy on my phone, and the coordinator does as well. So we're always there. And that's a system that we have been implementing, and we've adapted for over a decade now. So it's proven. Yes. It works. It works really good and takes care of our patients very well. And my patients have always direct access to me via email or phone. Why us? We said Mexico, and then maybe did you do a little research on somebody else?
I did some research on Tijuana. A couple of places over there. A couple of my friends have gone to various places over there, and I just, they seemed okay. And I might have been okay with going. But I have something a little odd about me. I have very high white blood cell count. And anyway, when I spoke to Brandy, my patient coordinator, about it, and she was like, Dr. A will hook you up. You'll be fine.
Yeah, and we did pick it up, by the way, really quick on the pre-op work.
And so, yes, my white blood cell count is high, but nothing to worry about. And I've had surgery, and I'm fine. So
good. And you're close by as well.
Yeah, and I had clearance from my hematologist at my doctor at home. So,
perfect.
Worked great.
Perfect. Well, I really appreciate you. Number one, your trust. Number two, coming back.
Certainly.
And number three, sharing a little bit about your journey here with us and the audience. And that I just wanted to pick your brain a little bit on the aspect, the first few weeks right after surgery that a lot of patients can benefit out of. I appreciate your time.
Awesome. Thanks.
Thanks so much.
All right.